This year, Howard County General Hospital celebrates 45 years of caring for the Howard County community and 20 years of being a member of Johns Hopkins Medicine. Interestingly, Howard County General Hospital was part of Johns Hopkins from its start in the 1960s. Columbia developer James Rouse envisioned a healthcare delivery system for the residents of his new planned community that was as unique as the model for Columbia itself. For help, he turned to the Johns Hopkins Hospital and the Connecticut General Life Insurance Company, which was financing Columbia's development. On October 1, 1969, Johns Hopkins, in partnership with the Connecticut General Life Insurance Company, entered into a new prepaid voluntary health insurance program, which was called the Columbia Medical Plan, with the primary emphasis on prevention of illness. The hospital itself was officially founded in July 1973 and was named the Columbia Hospital and Clinics Foundation. Designed to provide inpatient support for members of the Columbia Medical Plan, the hospital provided short-term care, such as overnight stays, infant deliveries, and simple surgery. Within a year, the facility was turned over to a community-based board of trustees. It became a private, not-for-profit institution, a model hospital and a model community, and the name was changed to Howard County General Hospital. Through the years, the hospital grew to accommodate the needs of the growing community of Columbia, as well as Howard County. Fast forward to 1997, when many community hospitals were seeking alignment with larger health systems. Vic Broccolino, president and CEO at the time, realized a partnership with a larger health system would help to expand the facility to meet the future needs of the community. After a 2-year planning period, the Howard County General Hospital Board of Trustees voted to become a member of Johns Hopkins Medicine and the first community hospital in the Johns Hopkins health system.
I'll tell you why, because I think Vic really did look to the future and saw he could not make the hospital any better than he had without outside help. And the outside help was access to capital and access to intellectual property. And those are the two things we had.
Today, the diverse community we serve benefits from a full range of specialists, including a medical staff of more than 1,000 physicians and allied health professionals, representing nearly 100 specialties and subspecialties.
And so over time, many of the services down there have had the benefit of being involved in one way or the other with Hopkins clinical department. So there's a fair amount of both functional and clinical integration that has occurred over the years.
The rapidly growing and aging population in Howard County, with the age 55 group projected to grow more than 40% in the next 5 years, needs a community hospital to grow with them and care for them in new ways.
If you think of a community that's ready to embrace population health, a community that really cares about each other and the resources required to make a population healthy, Howard County is a place where we can do that. And so we're really looking at that to lead the way in our commitment to transforming healthcare into population health.
The changing healthcare marketplace values caring for patients in the right setting and at the right cost, and encourages hospitals and physicians to provide the best quality care.
But what you get with Johns Hopkins Medicine is literally the world's best researchers and critical thinkers who have the goal of the patient experience in mind, but they also have the drive for innovation and being on the cutting edge of what the best patient care is.
When we look back over the evolution of Howard County General Hospital, there has always been a focus on putting plans in place to care for future generations of families in this community. And as we look into the future, we know that in order for us to care for the growing population in Howard County, we also need to grow. This will require further collaboration with Johns Hopkins Health System and the development of assets and strategies to meet the needs of the residents of Howard County. And I say this because it's important in the context of the broader requirements of our health system with respect to the evolution of healthcare in Maryland and across this great nation. You see, populations change, communities change, and the healthcare environment is ever changing. But at the end of the day, it is really about making the best decision possible to take care of the people within this community. We remain committed to delivering on the promise of medicine.